member for Kings West.
Thank you, Mr. Speaker. Just 10 months after the brand-name version of OxyContin was removed from circulation, Nova Scotia is in many ways back to the drawing board. With the federal minister's approval of the generic form of OxyContin, it will be only a matter of time before the number of prescriptions rise for the soon-to-be-available generic. Earlier this year, the Minister of Health and Wellness of the day issued a press release removing OxyContin and OxyNeo as a benefit under the formulary and listing OxyNeo as an exception status drug for the purpose of prescribing. Mr. Speaker, I will table this release. Could the Minister please confirm whether he plans to keep these same restrictions on the generic version of OxyContin?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker, and I appreciate the question. I don't agree with the member when he says we're back to square one, because we've worked extremely hard over the last number of years to put in controls, put in services, and work with our partners when it comes to addiction, especially around opiates here in Nova Scotia. We recognize it's a serious issue, not only here in Nova Scotia, across the country. That's why, as I was pleased to have the chair of the Ministers of Health meeting here in Halifax this summer, and that's why I was pleased to have all health ministers, including the minister from Quebec, agree to ask the federal minister to hold off approval of the generic form of OxyContin. No question, I can tell the member I was disappointed with the announcement of the federal government not living up to that and going ahead with approval of that. We're going to continue to work here in Nova Scotia with our partners in law enforcement, our partners with the College of Physicians and Surgeons, with the members of their staff and students at the medical school, and our pharmacists, to ensure that we don't see what we've seen in the past when it came to abuse of OxyContin in our communities across Nova Scotia.
Honourable member for Kings West.
Mr. Speaker, we were all disappointed with the federal minister's decision. However, her inaction does not mean this minister can absolve himself of his responsibility. This minister has choices. He can ensure every health care partner is doing their part to stop the scourge of abuse related to prescription drugs. He himself can take an active role in reducing prescription drug deaths, and there have been 269 in Nova Scotia in the last 5 years alone. Or he can point fingers. Could the minister please indicate whether he has advocated to his federal counterparts that all opioids, including their generic versions, be tamper-proof before they are approved in Canada?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. And unfortunately, I don't think that may do any good, as we've seen with the most recent announcement on behalf of the federal government. No question, Mr. Speaker, we continue to work with our partners. We have a unit from Dalhousie that goes out and educates and hopefully works with, not hopefully, I know they work with physicians across the province, Mr. Speaker, ensuring that they have the most up-to-date information around the use of opiates, for example, for any of their patients that comes in. But we also have to recognize that there is a role for pharmaceuticals play in healthcare services and opiates, Mr. Speaker. We need to make sure we have the controls in place, like the prescription monitoring program that I'm glad to say that we extended to 24 hours, 7 days a week earlier this year, Mr. Speaker. There's another tool that not only law enforcement but pharmacists and physicians use to try to curb the abuse of prescription drugs, Mr. Speaker. So we'll continue to work with our partners. We'll continue to work with clinicians within the healthcare system to move forward on any approval of any medication on our formularies here in Nova Scotia, but more importantly, to try to address and not have what we've seen in the past when it comes to the addiction of opiates like OxyContin, Mr. Speaker.
The honourable member for Kings West on his final supplement.
Mr. Speaker, I will reiterate the role and responsibility of this minister to ensure he is doing his part to stop the scourge of abuse of prescription drugs, not just step back. Earlier this spring, the Auditor General issued 17 recommendations to address a prescription drug monitoring program. According to the AG's statement, around the prescription monitoring program, significant weaknesses in control and monitoring processes open the possibility that misuse or abuse of monitored prescription drugs continues undetected. Could the minister please provide an update as to where we are when it comes to improvements in monitoring and control systems and in the development of more responsive online technology that will better track prescriptions, since we don't have a just-in-time system?
Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. Thank you for the question. We're working extremely hard with our partners. As I mentioned earlier, just by extending the availability of the prescription monitoring program, Mr. Speaker, to our partners, that helps to one aspect of dealing with this issue, Mr. Speaker. There's many more that we need to continue to work with. And one of the #1 ways we can ensure that we can tackle this issue in our communities across the province, Mr. Speaker, is to discuss it, to ensure, especially our young people, recognize the dangers of mixing prescription drugs and alcohol, for example. We know with recent deaths in our province, Mr. Speaker, they seem to be around those young university-age individuals, Mr. Speaker, people who don't have an addiction problem, Mr. Speaker. So not only do we got to support and provide services to those who find themselves addicted to opiates or other pharmaceuticals, Mr. Speaker, we have to educate our young people and all Nova Scotians, for that matter, Mr. Speaker, on the importance of not mixing pharmaceuticals and alcohol, for example, Mr. Speaker, because there's a danger in that where you can ultimately, by taking one pill, Mr. Speaker, die from that result.
The honourable member for Kings West on a new question.